So immediately after medical school, I was a doctor to the Barrio. I spent 3 years in Canberra, Sarangani before coming to the United States in 2011, I think. I had a full-time job during the day. And then after my full-time job, I would shut off everything and just go to that little house that I have there and basically study for the whole night for the exams, because I know that they were very expensive exams and I had to pay for them myself with the salary from the doctor to the Barrio. So I knew what was at stake. Having a goal in mind and not even trying or not doing my best to try to accomplish that goal, I know that it would haunt me for the rest of my life.
Welcome to Linguist Access Podcast, where we all get together to learn more about inspiring stories behind every journey that will give you the courage to push past challenges and overcome obstacles, all for God's glory, with your host, Shalini Oritaves.
Welcome back to Linguist Access Podcast, where we dive deep into the stories of extraordinary individuals who are making waves in their fields. I am your host, Sha, and today we have a very inspiring, truly inspiring guest, a native of the Philippines. As a matter of fact, we share the same hometown, General Santos City. Even before he demonstrated consistency in academic excellence, a strong dedication in medical field, he graduated summa cum laude in Mindanao State University, Bachelor of Science in Biology, as well as a Doctor of Medicine, University of the Philippines. And of course, I am just very proud to say that now he is a medical practitioner with extensive residency and fellowship experience, coupled with advanced education in digital health and artificial intelligence, further enhancing expertise in the growing field of health and technology. June of last year, he acquired certification of completion, digital health product development from Stanford University, California, and currently pursuing specialized programs, Infectious Disease Digital Institute, offered by the Infectious Disease Society of America, and even certificate course of an artificial intelligence from strategies to implementation, Harvard University. With a strong commitment to ethics, innovation, and technology, I am very proud to welcome Dr. Lemuel Non.
Thank you very much for the invitation. I'm really glad to be here.
Now, let's talk about your life when you were young. Did you ever think of becoming a doctor?
Yeah, actually, no. It was my dad and my mother who basically pushed me to go to medical school. After high school, I was set on becoming an engineer. So I actually passed the entrance exam in UP Diliman. I was set to go to computer engineering. And then my dad basically stopped me and my mom enrolled me in MSU Jansan. So that's how I became a graduate of MSU Jansan. And I mean, I was very happy with that. I'm in a situation, I tried to make the most out of it. So yeah, I think, and I found really good friends in MSU Jansan. I found forever friends there. I had a great experience, a great time in MSU Jansan. And then after Bachelor of Science in Biology, my dad then basically went to the UP College of Medicine and submitted my application. I told them that if I don't get into UP College of Medicine, I will be pursuing a PhD somewhere else. Fortunately, I got into UP College of Medicine. I was the only one from MSU that time who got admitted in the UP College of Medicine. We had like 160 students in our class and only 10 were outside of the UP system. So I was really very fortunate to have gotten into medical school. So that's the story basically. You know, even though I was somewhat forced into medical school, I still tried to make the most out of it. Yeah. So that's how I ended up becoming a doctor.
Oh, but how long have you been a doctor, Doc Lem?
Yeah. So I graduated medical school in 2008. So I have been a doctor since then. Yeah. So I started, my first job was actually very interesting. So I was a doctor to the Barrio. So I spent some time in Kiamba, Sarangani. So immediately after medical school, I was a doctor to the Barrio. I spent 3 years in Kiamba, Sarangani before coming to the United States in 2011, I think. Yeah. So, and I've been in the US since 2011.
Okay, wow.
I pursued further training here in the United States. So
So why did you choose America among the many countries in the world? Why United States of America, Doc?
that's a good question. So when I was in medical school, I looked up to this one teacher. He was our teacher in biochemistry, and we did some research together. And he told me one day, and this was after I asked him for some advice, for some career advice on like what to do and what to pursue. And he told me that I would do well if I combine research with my training. And he said that I would probably have the best experience if I go to the United States to pursue further training in either infectious disease or pathology. And I took that to heart. I took that advice to heart and I set that as a goal. And yeah, so even though I was kind of diverted, I was in Sarangani for like 3 years. I kept that goal going even when I was there. So yeah, I chose the US and I chose infectious disease mainly because of I was inspired to combine research with my clinical training. Yeah. So
So how long did you have to wait to come to the US? Because I know there's really like horror story about, the waiting period. And what was your struggle when you got here, Doc?
I graduated in 2008, but I did not really apply to the United States right away because I had to review for the local Philippine board exams. So that took, a couple of months out of our time. And then I had to settle in Sarangani after medical school. So I didn't apply maybe until a year after that. And to get to the United States, you have to pass at least 3 to 4 exams. So there's step one exam, which we had to take in Manila. Step two, also in Manila. And then the second part of the step two exam, we have to take in the United States. So it was a very expensive, very grueling experience, actually. Yeah. So when I was in Sarangani, I was a doctor to the Barrio. So I had a full-time job during the day. And then after my full-time job, I would shut off everything and just go to that little house that I have there and basically study for the whole night for the exams. Because I know that they were very expensive exams and I had to pay for them myself with the salary from being a doctor to the Barrio. So yeah, so I knew what was at stake. So I had to really focus and give everything that I had.
Can you tell me more about your medical experience? I want to know more about that. Can you shed some light on that?
So after medical school, I became a doctor to the Barrio in Kiamba, Sarangani. Personally, I think it's one of the most interesting parts of my life. I'd only spent 3 years there, but it was really very, very fruitful. That's where everything started, basically. Okay. So to get to the United States, I had to spend some time in Kiamba. So that's where I was studying. So during the day, I would serve patients. I would do a lot of administrative work. I would supervise all the public health nurses, midwives, all the barangay health workers. So I had an 8 to 5 job that was really very, very busy. Many times we would have to go to many barangays, go to the mountains, cross rivers to deliver healthcare. So this was during the day. And at night, I had to spend some time. I had to shut off everything to study to get to the United States. So, and what was interesting actually was during my first week on the job, right? There was this big fight between militia group and the government. And being the only doctor in town, I had to take care of all the casualties during that big fight. So, looking back, I was a fresh graduate from like medical school. It was scary to be in that situation, but I thought it was very, very interesting. It definitely gave me a lot of perspective as to what other people are going through. It's not easy to live in those areas. And I had a very good grasp of their struggles. I guess one reason to add, I would be happy to go back to the Philippines in the future to serve those kind of people, to help them. They're the ones who are truly in need. So I guess my point was, even though I'm in the United States right now, everything actually started in those 3 years. All the empathy, all the compassion that I have learned over the years started, in those first 3 years. I became a grown up really very, very quickly because I had to supervise much older people than me. So yeah, it was a very, very good learning experience. It was a very steep learning curve for me, and it helped me while I was training, internal medicine in Philadelphia and then infectious disease in St. Louis, Missouri. Those experiences in Kiamba, Sarangani in the Philippines were really transformative and helped me a lot for my eventual training here in the United States. So yeah, for all the young doctors out there, if you're looking for an adventure, for an experience that could change your life, that's something that you could consider before delving into your future careers.
Out of curiosity, how long do you have to study for you to become a medical doctor here in the United States of America?
Before you get into all the different training programs, you have to first finish medical school. So in the UP College of Medicine, that's 5 years. Five because our internship is of like 1 year is mandatory with our curriculum. So 5 years of medical school for us. And then after that, for me at least, internal medicine was 3 years. And then after that, I did 2 extra years of infectious disease fellowship. So 5 years of training, 5 years of medical school, and I guess 4 years of undergraduate studies.
So right now, Doc, you're seeing patients from time
I
to
am.
time.
Mhm.
What's the
I'm
difference?
seeing not much difference. So I am what you would consider an academic physician just because I work in an academic hospital. So right now I'm an associate professor in the University of Iowa Hospitals and Clinics. And even though I have that title, I do see patients all the time. Okay. But I am also in charge of training other physicians. So other physicians who want to be infectious disease specialists, I'm part of their, training experience. I also teach some lectures to residents and to medical students. And as part of being an academic physician, we are also somewhat required to produce scholarly activities. And that includes, research, publishing papers and all that stuff. So right now I am very much involved in transplant infectious disease research and also artificial intelligence.
My question is that, is it necessary for you to be a board passer, like a licensed physician in the Philippines in order for you to practice in the United States of America as a doctor?
Not necessarily. I know a few classmates who did that, who did not have to take the Philippine board exams before coming to the United States. But of course, it would be a good way because there's a lot of uncertainty with the US process because you have to take all these multiple exams. And then after you take all these exams, you actually have to go through a match process. So what happens is that you have to apply to this matching system. And then the hospitals would then choose whoever they want to interview. So you will have to physically go through to these interviews to see if the hospital will like you to be future resident physician in their program. It's a very long and arduous process, actually. So exams and then interview process before becoming part of the US medical system.
So, Doc, this is something that, just pop up in my mind. If you are practicing in the Philippines, like, hypothetically, is this kind of career available also in the Philippines or it's only in the US?
Yeah, not so much. I mean, there are very few academic centers in the Philippines. UP, PGH can offer similar experience, but not to this level here in the US. And that's part of the reason why I actually came here to experience the level of training and to be more involved in like research. Yeah. Unfortunately, there's not much experience like this in the Philippines. Like if you practice in the provinces, there would not be this kind of experience.
Oh, okay.
Unfortunately.
Okay. I mean, it's something also that we should, the Philippine government should contemplate about, but I think it would really require much resources. I mean, because research and development is something that I know badly needed in the Philippines, but at the same time, coupled with that is a huge budget, I think, which unfortunately Philippines at the moment may have difficulty setting budget, especially in this kind of medical practice. Doc, you seem to be very successful in almost all your undertakings. Now, can you tell us one thing, or maybe, just an experience of a failure? Did you ever fail?
Yeah, I mean, that's a good question. And I'm sure I've had my fair share of failures and losses in life, but I guess I just don't dwell much in those failures. I mean, every time I fail at something, I would move on right away. I would think of that as more of an opportunity to grow. I would evaluate that failure and see how I failed, where I failed, and try to improve myself like immediately after that. So yeah, I mean, I've had my fair share of failures and, but yeah, I just move on.
Yes, Doc. Actually, it sounds like it's impossible for you to fail with all your, discipline. But can you cite
No.
an example, Doc, that you failed and how did you overcome that after?
I'm into research a lot, right? You've heard my story, and I've had a couple of times where I would apply for a grant for like research, and it turned out that my idea was not good enough. And I would spend a lot of time, like hours and hours, pouring myself into the preparation of that grant just to be rejected. Okay. So I've had a couple of that. And then, so also right now, I'm trying to venture out of medicine and more into the tech part of medicine, actually. And that tech part of medicine is very entrepreneurial, right? So you have to do pitches or, pitch decks to many judges or VCs or venture capitalists. And I've had my fair share of that as well, where I would present an idea, hoping to get funding, but then I would get shut down. So yeah, so I've had a lot of those experiences for sure. And each time I fail, each time I lose at something, I would just reassess, where did I go wrong and how do I improve myself so that the next time that, that happens, I could further improve my work. Yeah. Yeah. And so far, I think it's been good. So like recently I got a grant for a research in transplant infectious disease. And this was after a couple of tries. I'm very happy about that. I'm going to start a research project soon. I'll be enrolling patients in my study. So, and then for the tech side, I also just recently got a grant to do research in artificial intelligence. So yeah, I'm very excited about that part too. And this was after many tries of submitting an application for it. Finally, I got something. So yeah.
Doc, this is just also something, maybe, I don't know if this is timely, but with Elon Musk, inventing robots, replacing household chores, you think
Yeah.
nurses, doctors are replaceable with robots?
Nurses, definitely no. I don't think so. I think that AI and maybe some robots in the future could replace more of a like jobs
Routinary.
that exactly, yeah, those that follow certain regimens, very, very procedural. But I mean, to be a nurse, you have to have compassion, you have to have humanity. So there's a very big difference between what human nurses can offer versus what robots can do. I'm sure robots are very efficient in doing some stuff, but they can never replace the humanity of nurses and doctors.
The empathy, the thorough assessment, the critical
Or yeah,
thinking. Yeah. So that's a good
yeah,
thing to know, hearing from you, Doc Lem, that you are promoting artificial intelligence, but at the same time, you also see that demarcation line between robots and humans.
for
It's just
sure.
a powerful thing that you still
Yeah.
discern the difference between these two. This is just pretty interesting for me. Like, how did you develop your study habit?
I don't know. I guess, yeah. I'm not sure how exactly, but I know what works. I know that by focusing, by setting goals, by actually envisioning a future, I think that kept me going. Every time I study, I would just really focus. Many years later, I encountered a term for what I was actually doing. It's called deep work. I guess Cal Newport had a book about that. It's a good read if you haven't read that. Deep Work. by Cal Newport is a very good book. It's about really immersing yourself and focusing in something, in what you're passionate about. And in my case, it was just, checking off goals. My goal was to come here to the United States. So I had to spend hours at night to study. So I would close everything off and just study.
Yes, Doc. Who
So
inspires you to keep going, Doc? I mean, I know it's not an easy ride, despite the
for sure.
challenges.
Yeah, right now for sure, my wife and two kids. So they inspire me all the time. Every time I would engage a new activity, I always have to think to myself whether this is something that will contribute to a better life for us, if it would help me in the future. So I don't say yes to everything. I would only say yes to things that I think would benefit me and my family in the long run. Yeah.
Mhm.
And it helps to keep you focused instead of scattering yourself all over. Right. So, yeah.
Yes. How do you balance work, family, and personal life? I know this is something that it's hard to really balance it. I mean, your job might be very, I know for sure that it's demanding, but how do you
Yeah.
create balance?
Yeah. I think for me, I guess I'm somewhat lucky because, I'm in a field that is not too busy. It's not like surgery or
Mhm.
cardiology where they do a lot of procedures where they have to really spend a lot of time at
Mhm.
work. So what I try to do with my schedule is that I would be strict with my time. From 8 to 5, that's my work hours. I would only work during those hours. I would try to finish everything, and then after 5 p.m., I don't basically take my work home. I stop working.
Oh.
I only do home stuff after that. So
Mhm.
I try to compartmentalize myself based on those hours. And so right now, what works right now for me to be more efficient is that I try to use technology to help me get things done. I mean, we have artificial intelligence right now, generative AI chatbots. So I use that a lot to help me with my job, finishing notes, and interacting with patients, finishing papers. So I try to really finish everything by 5 p.m.
This, Doc, I really want to ask you this. How do you define
Mhm.
success?
Yeah, that's a good question, and I'm sure there's a deeper answer. But for me, my simple definition is just checking off goals. Be clear with your goals and try to envision yourself achieving those goals and try to not waste time. Basically, use every hour, every minute of the day thinking about how you can get to that goal in time.
Doc, do you consider yourself successful now?
Yeah, that's a hard question. I think that for me, goalposts would like move every
Mhm.
time. I mean,
Mhm.
the goal that I had for this year, I think I've already achieved, and I just don't stop there. I have new goals for the
Mhm.
next year. So even though I have, goals for like this year that I've already achieved, I think for me, I just don't stop there. I try to make new goals for myself for the following year and for the next few years. So yeah, I mean, based on my own definition, I mean, I have checked off some goals for like this year, but I also make new goals almost every day. So it's a continuous process. I don't stop making goals.
Mhm. Now, I want to ask also, this is something that, not everyone is trying to avoid to answer questions like this. What is your greatest fear at this point of time, Doc?
That's a good question and a very deep one. My greatest fear is actually having a goal in mind and not even trying or not doing my best to try to accomplish that goal. I know that it would haunt me for the rest of my life. All the what ifs, that's my greatest fear.
Yeah. If you could turn back the time, what could you have done differently?
That's a good question. I'm not sure that I would do anything differently. I mean, I'm sure that I would probably have made different choices before,
Mhm.
but I think that everything happens for a reason.
So will you take the same path, Doc? Like, becoming a doctor in the US, if given a chance to live again, relive your life, you're going to be still
Hmm.
a doctor in the United States of America. Is that going to be your goal?
Probably not. If I had more freedom back then, I would probably have become a computer engineer because that was my initial goal. But like I said, I think that everything happens for a reason. I may not have been an engineer, but I'm doing something related to that field right now. I'm in medicine, but I'm also engaged in like artificial intelligence and digital health. So life is a funny way of connecting you back to past moments. So
Yeah, in that kind of field, Doc, what makes it different from the traditional kind of medical profession?
yeah, it's very different because it's very novel. I mean, medicine is something that has been there for like decades and decades. So it's very, very well established. These new artificial intelligence and digital health are really very novel. Only very few people in the world are experts in these fields. So it is actually up for grabs.
You are very successful in all in this multiple domains, Doc. Now, have you thought of retiring in the Philippines?
I definitely have, for sure. I mean, I would love to go back and again retire there and spend more time with my family. But my family right now is actually mostly outside of the Philippines. Like my parents are in Canada. My sister, who's a nurse, is also coming to the United States soon. So it's only my one sister who's in Gen San. So if I were to go back to the Philippines, it would be for her and for the rest of my wife's family.
But, you know, thinking about retiring there, I don't think it's going to be a bit feasible, knowing that your profession is, I mean, it is good to be able to help in the Philippines. I mean, right? But just augment manpower, especially in terms of in the field of medicine. But then again, I think you have a very well-established career here in the US.
Yeah, for sure. I mean, I don't mind going back. If I were to go back, you're absolutely right. It will have to be fruitful. You know, I want to serve. I definitely want to give back. But if that opportunity does not exist for me, then I'm not sure I would spend some time. My reasons for going back would be family and maybe to give back. But if those reasons are not there anymore, then maybe not.
Yeah, that is true. That is true. And would you advise a young doctor to take the same path with what you're taking right now?
Yeah, I mean, it's a very challenging path. And I mean, for me, it worked because I really liked the journey. There were definitely some struggles here and there. The first few years here in the United States were a struggle. I mean, it's a new environment, new cultures everywhere. So, I mean, if that somebody is willing to go through that, then yeah, I think there is definitely light at the end of the tunnel.
That's
Yeah,
true.
I think it's a worthwhile experience to go through. Yeah.
So, Doc, as we wrap up, is there one piece of actionable advice you'd like to give to our colleagues or to all who are watching and listening to this show?
My one piece of advice would be to set goals for yourself. Think of yourself like a brand, basically. Set a vision for what you want to become. Set your mission for how to accomplish that vision of yours. Stay focused. Deep work is something that has worked for me, and I'm sure it will work for many people. So try to immerse yourself and work hard towards your goal.
That's truly inspiring. Now, before we go, where can our listeners find out more about your ventures, Doc?
They can get in touch with me in Facebook or in LinkedIn or in Twitter. I'm not very active in social media right now because we have a newborn. But yeah, I am at most of those
Platforms.
social media platforms.
I'd like to really say that your life story is really something that all Filipinos should be proud of. I mean, they have to hear your story. Thank you very much for your time, Doc. And I hope that you'll continuously not just make a good living, but make a difference in the field of medicine.
Thank you very much. I'm trying every day.
Congratulations, Doc Lem, for all your achievements and for whatever it is that you are about to achieve in your life. You really deserve everything because of this hard work. For all our audience, stay tuned for more inspiring stories like this.
Thank you for listening to Linguist Access Podcast. Please give us a review on iTunes, leave a comment, like, share, and subscribe. See you on the next episode.